A few weeks back, one of the therapist trainees at the clinic I direct texted me from a class she was attending at her psychology graduate program and said that the guest lecturer was linking the cause of depression to people having a chemical imbalance. She remembered I had mentioned in supervision once that the premise of a chemical imbalance is a myth that keeps on propagating in psychology and counseling programs by folks that should know better. We shouldn't be too hard on that particular psychology professor for continuing to advance the myth of a chemical imbalance as the cause of depression in many folks. According to Scientific American, much of the general public and psychology professionals and students seem to have accepted the chemical imbalance hypothesis uncritically. For example, in a 2007 survey of 262 undergraduates, psychologist Christopher France of Cleveland State University and his colleagues found that 84.7% of participants found it likely that chemical imbalances cause depression. Unfortunately, this explanation that continues to sustain is false. In reality, depression cannot be boiled down to an excess or deficit of any particular chemical or even a suite of chemicals. According to Scientific American, no studies have established a cause and effect relation between any brain dysfunction and the disorder. In addition, depression almost certainly does not result from just one change in the brain or environmental factor. A focus on one piece of the depression puzzle, be it brain chemistry, neural networks, or stress, is short-sighted. So why does this chemical imbalance narrative seemingly have so much strength? Psychology and philosophy writer Olivia Goldhill believes it's due to psychiatry's attempt over the past half-century to portray depression as a disease of the brain, casting aside the social factors that contribute to depression, such as isolation, poverty, oppression, or tragic events. This narrative privileges pharmaceutical treatments, leaving non-pharmaceutical treatments such as therapy and exercise to play second fiddle to drugs. Now, the debate on the efficacy of medications for the treatment of depression are beyond the scope of this video. However, I will say that Olivia Goldhill, in her piece, that I will link in the notes, references the work of Irving Kirsch, Associate Director of the Program in Placebo Studies at Harvard Medical School, whose work showed that there's very little difference between antidepressants and placebos. They're slightly more effective than placebo, and the difference is so small it's not of any clinical importance. Kirsch now advocates non-drug-based treatments for depression, pointing to studies that show that while drugs and therapy are similarly effective in the short term, in the long term, those who don't take medication seem to do better and have a lower risk of relapse. On the other hand, having said that, it can be argued that many people respond well to antidepressants and that the reason drugs become so popular is in a large part because many patients benefited from them and experienced significantly reduced depressive symptoms. Confusing, I know, but this confusion can make room for possibilities. Now, I have no interest in trafficking in pharma trade, but as a clinician, I'm interested in discovering how these medications have helped or not helped. And if someone should come to me carrying the chemical imbalance metaphor, rather than pointing out the errors of their ways, I am more interested in honoring what they experience this particular narrative to be doing for them, how it might be giving them ground to stand on, or how it might be making other considerations possible, like not feeling alone in the struggle against depression, for example. So finally, what might the chemical imbalance narrative blind us to? Goldhill writes that depression is now a global health epidemic affecting 1 in 4 people worldwide. Treating it as an individual medical disorder, primarily with drugs, and failing to consider the environmental factors that underlie the epidemic, such as isolation and poverty, bereavement, job loss, long-term unemployment, and sexual abuse, is comparable to asking citizens to live in a smog-ridden city and using medication to treat the diseases that result instead of regulating pollution. So in other words, this chemical imbalance narrative can continue to distract us from working toward the substantial societal changes that engender a higher quality of life, like safe and affordable housing, racial and gender equity, meaningful employment, strong local communities to combat loneliness, all of this leading to communities that have fewer mental health issues and that would be ultimately far more productive for our society. My name is Chris Hoff. This has been The Radical Therapist. Please share this video widely. Please hit the like button. Please subscribe to my channel. And as always, thanks for watching. Hi everybody, thanks for watching this video. I'm Dr. Chris Hoff. This is the Radical Therapist channel. If you'd like to subscribe to my channel, you can do that right over here. And if you'd like to see another video, you can do that right here. And as always, I appreciate the support.